to the Flourish podcast with Dr. Tony Ingram, where you will hear straight from some of the best practitioners and leaders in wellness on how to take control of your family's physical, spiritual, and mental health, because we are all designed to flourish. As a reminder, this show is for educational and entertainment purposes only. Nothing said on the Flourish podcast can be taken as medical advice. For your own specific medical advice, please always consult with your own healthcare providers. Now, let's get started. Welcome back to episode 9, and this just happens to be part 2 of my interview with Ashley Deely. Like we said in the last episode, Ashley Deely is a former personal trainer, Pilates instructor, certified nutrition coach, and is the host of the Welcome to Wellness podcast. So she was so gracious to invite me to come on her show, and she interviewed me, and we had such a fun time. The first episode, we decided to do a part 2 because we really wanted to dig into some of these other topics. So if you haven't listened to the first episode, please go back and listen to that one first. It was really a great conversation, and we had another great conversation today. So I hope you enjoy.
Dr. Ingram, welcome back to the show.
Thank you so much. I'm glad to be here.
I'll tell you, one of my biggest letdowns with podcasters is they'll have these legendary guests on, they'll get into these great discussions, and then they'll say, oh, I have to have you back on the show. And they never do. So I couldn't wait for round 2. I prepared so many questions for today. And I think where I'd like to start is where we left off last time, which was talking about the Fluoride Action Network. And I have to tell you, I took a deep dive. I went down the rabbit hole. I listened to all your podcast episodes, including the one with Erica. Is it Acuna?
Acuna, yeah.
Yeah.
Oh, I'm so glad. Good.
So that made me really happy. I think one of the things I wanted to touch on and that I wanted to bring up again was something that Erica said was, if fluoride worked, why are people still getting cavities?
That's the $1,000,000,000 question. If it really worked, what the heck is the deal? Caries rates still are steady, and tooth decay is still one of the most common reasons that children miss school in this country. So it's still a huge issue, and clearly the water fluoridation program just didn't do the job that it was intended to do.
I didn't know that's why kids were missing school. That's pretty shocking.
Yeah.
Wow. Okay. So also I wanted to repeat exactly what Erica said, which was, we don't have a fluoride deficiency. We have a nutrient deficiency.
100%. Isn't that gold?
It was so good. I was like, I have to say that on my podcast. Give Erica the credit, which takes me into my next topic, which we touched on in the first episode, but I don't know if people know who Weston A. Price is. We talked a little bit about nutrition and that episode that I had with the president of the Weston A. Price Foundation, but can you give us a background about who he is and what his studies showed?
Yeah, so Weston A. Price was a dentist by training, a dentist by trade, in, I believe, Cleveland, back in the early 1900s. And he did some mission work, did some research in other third world countries and third world areas where there were more native cultures. And he just found it really interesting that in these native cultures, that it just so happened that the children had far fewer dental problems. They had these nice broad jaws, very straight teeth, and no cavities. So when he started digging in a little bit more, it seemed like there was a pretty direct correlation between when a society or a community would start adopting more of a westernized diet, a diet of more grains, more highly processed foods, and when these children started to exhibit these oral deficiencies, they started to have more crowding in their teeth and they started to have more tooth decay.
I feel like that's really eye-opening. I think one of the controversial topics from Weston A. Price is that because we're eating softer foods, we have smaller jaws or smaller skulls. Can you tell me your opinion or thoughts on that?
Yeah, well, and now there's really some good data behind that theory. And has really influenced modern orthodontics and why orthodontics has changed so much over the last 30 years. So when we look at crowding, there are actually a lot of factors that lead to crowding. And we have to, to understand that, we have to back up even further. I feel like, so catch me if I go down too many rabbit holes or if I get off track. But the principle that we really have to understand is that our skeletal growth and development follows soft tissue function or lack thereof. So bone follows soft tissue always. That's why we lift weights, we strengthen our muscles to improve our bone density and lessen our chances of osteoporosis, because the more we use the muscle, the soft tissue, the stronger the bone will get. Same thing in our mouths. We see this in many different ways in our mouths. So if we lose a tooth, we will actually, you're losing some soft tissue in that area, that soft tissue that connects the tooth to the bone. So we will lose bone height and we'll lose bone thickness. Again, the bone is the result of the other tissue in the area. In gum disease, gum recession leads to bone loss, which is what eventually causes tooth loss. So bone always follows the soft tissue. And in the mouth, in growth and development, if, like, let's say there is a tongue tie, the tongue is too tightly tethered to the floor of the mouth. Well, the tongue is really designed to be the strongest muscle in our mouth that guides the growth and development of our palate, of the size and width of our jaws. If that can't happen, if there's a tongue tie, if someone's mouth breathing, leaving their mouth hung open all the time, then the tongue is no longer the strongest muscle in that area that it's supposed to be. And your cheeks become the strongest muscle in the area. So again, the bone follows the soft tissue. It follows the function of those muscles. And so if the cheeks are the strongest muscle, we're going to grow and develop these much more narrow jaws. Whereas if we are chewing foods that require a lot of chewing, like meats and tough vegetables, tough plants, if we are nursing for a long period of time and able to open our mouth around mother's breast, then all of those things combine to give us healthier, widely developed jaws that are less prone to crowding and other problems. So to go back to, we start connecting that to what Weston A. Price was seeing in his research. His theory was that poor diet led to a malabsorption of nutrients. This malabsorption of nutrients led to inflammation and more allergies, which then led to mouth breathing, which then led to, if you're sleeping with your mouth open, again, then we go back to what's the strongest muscle in the area. So it's all connected. It's not necessarily just the diet, just the fact that there's sugar and the diet is processed and it's crap, basically. It really is that it all affects the function of the soft tissue. So as that function of the soft tissue goes, then the hard tissue will follow and the bone will follow.
There's so much to unpack there. I'm really glad you gave us that thorough explanation. So maybe it doesn't sound like a Go-Gurt or applesauce should be your go-to snack for your kids.
Exactly, which is so hard because we're, especially, and I feel like this era, we're so protective of protective and permissive, maybe sometimes to a fault. So yeah, the Go-Gurts, the applesauces, the things that seem like they are at least a healthier option, really are not doing our kids any favors as far as their growth and development is concerned.
Now, you talked about mouth breathing and how the tongue helps guide growth and development. So, can you unpack potentially how this is affecting our airways and maybe causing people to snore?
Absolutely. Absolutely. And again, it's like this horrible cycle for a lot of people, for a lot of the patients that come through my office. So what may start as a tongue tie, could absolutely lead to some pretty intense sleep apnea and airway issues as an adult that might go just under the radar and undetected for a long time. So how that happens is, again, when we talk about a tongue tie, and when we say a tongue tie, that just means that the fascia that connects the tongue to the floor of the mouth. In some people, there's a little string of tissue. You can lift up your tongue and see the string. For some people, that little string of tissue is not really visible. It's more of the fascia that's below the surface. But as that tongue is basically tied down to the floor of the mouth, it really cannot get up where we want it to get up. And once that happens, then yes, your jaw becomes more narrow, like we talked about. And as the jaw becomes more narrow, I mean, you can visualize it in your own face, in your own skull. If your jaw is more narrow, well, what's right behind your jaw? It's your airway. And so we look at CT scans all the time where we're looking at the jaw, but then just posterior to that is this teeny tiny little narrow airway, because that's all the room that you had to be able to grow. So as we get to, as we look at how the jaw grows and then how the airway grows, it absolutely follows suit and can sometimes, when we have a narrow airway, then absolutely we lay down at night, we lay on our back, then our tongues fall back even further and close that airway even further, which can absolutely lead to some snoring and some sleep apnea, some of those hypopnea events where you lose your oxygen saturation at night as you sleep.
That doesn't sound too good. So, are there ways that we can fix the airway? Do you need surgery? Walk me through some of those options.
I mean, if we can catch, what's really cool is that if we can catch it in our kids, we can avoid so many issues and so many surgeries, really, if we can catch it in our young kids. Like sometimes as young as 3, 4, and 5, we can start catching these narrow airways. And then you can do all kinds of appliances, orthodontic expansion devices. We can look at tonsils and allergies and all of these different things to help them grow more ideally in very minimally invasive ways, which is the goal. Now, if we get to adulthood and we have this narrow airway and we are having some symptoms, then we have to look at what's the actual cause of the symptoms. If it really is purely a narrow jaw and a narrow airway, and there's not enough room for the mouth is too small for the tongue, basically, then yeah, sometimes oral surgery is the only way to go. where an oral surgeon will literally go in and break your jaws apart and screw them back together in a way that opens things up. And that, if it's needed, it can be life-changing and life-saving. So it's a fantastic procedure to have access to. But man, we sure hope that we don't ever have to do that, that it doesn't ever get to that point. If we kind of take it a step back, if we don't have to do surgery, or if surgery is just not an option for that particular patient, then there are some devices that can do a decent job of opening up the airway. It's like an expander for adults. We have to be careful with those, and there are only certain practitioners that are trained and well trained in doing that without wreaking havoc, because sometimes those cases can go poorly. And when they go poorly, it's really, really not good. But it is possible to be able to get some expansion with some devices in adults. You can do a little bit of Invisalign and tip the teeth out just enough to get a little more opening. Again, you have to be careful with that, and you have to make sure that the dentist or orthodontist is really experienced in being able to do that, but that is possible too. There's actually, if we want to take it even a step back from that, even less invasive, there's a laser procedure that we can do. I actually do it in my office. It's called night laze. And the night laze procedure uses an erbium YAG laser, and it deep heats the tissue of the back of the tongue, the floor of the mouth, and the soft palate. And as you deep heat that tissue over 3 or 4 sessions every couple of weeks, you stimulate collagen fibers to build up. And as those collagen fibers increase, you can get tightening of that soft tissue to actually open the airway up that way. So it's a nice way to get some quick-ish relief.
I've never heard of that tech. I have a few follow-up questions. I know you're familiar with James Nestor's book, Breath, and the technique of mewing, and how I imagine professionals like yourself say that if there's not enough room in your mouth for your tongue, if your teeth touch your tongue when your mouth is closed, that you could potentially have smaller jaw or skull. So can you walk me through that technique and what professionals like yourself advise?
Yeah, I really like Dr. Mew and his techniques. I think it's really cool, and it basically just uses principles of myofunctional therapy, which, since Nestor's book, in the last 5 to 10 years, we've really seen an increase in education and an increase in training and an increase in dental professionals kind of joining hand in hand with speech and language pathologists to be able to do this oral myofunctional therapy, which is, I feel like there are differences, but it's basically the same thing. It serves the same function. It is basically physical therapy for your mouth. You're doing very specific targeted exercises, targeted stretches to try to build the muscles of the tongue, the face, the muscles of mastication in order to improve function, in order to place the tongue where it ideally should be placed, which is on the roof of the mouth, right behind the teeth, and against the hard palate to really give us more optimal function.
For someone who doesn't know what mewing is, can you please explain it?
Oh, yeah. So it's, once we got into OMT, into myofunctional therapy, it's been a while since I've looked at his stuff online, but it is exercises for your face, where you're strengthening your face muscles and your mouth muscles in order to be able to function and breathe more optimally.
Awesome. I saw a couple YouTube videos when I first read about it in James's
Mhm.
book, and then I was like, oh, okay, this makes sense. Of course, the guy who was doing the video was a model. And so he was like, oh, if you want stronger cheekbones, all you have to do is
Yes.
this mewing exercise.
Yeah. And I think they use like pictures of Kardashian girls to say, this is what this Kardashian looked like before. And here's what she looks like with more optimal jaw muscles. Um, didn't mention anything about any surgical interventions that might have happened at the same time.
Not.
I'm sure that wasn't a factor though. I'm sure.
Talked a bit about snoring, but something that has really helped, I might have to edit this or at least get permission, but something that has really helped decrease my husband's snoring is wearing mouth tape at night. Can you tell our listeners what mouth tape does?
Yeah, literally. And people look at us funny when we tell them to tape their mouth shut at night. But that's literally what it is. We literally tell people to tape their mouth shut at night. So mouth taping if mouth breathing at night has become a habit, but but you still have good nasal patency, good nasal function where you can breathe through your nose, it's just that habituated mouth falls open, then yeah, absolutely. You can it can be as simple as just one little strip of medical tape that covers your lips. Especially to start, start small. Don't make it feel like you're taping your mouth shut, and make it anxiety inducing. That doesn't do you any good. But just a small little piece of tape just to help build that habit of getting used to keeping the mouth closed can be really helpful for snoring, and for breathing and getting deeper sleep.
And why is mouth breathing a problem?
Mouth breathing is a problem for a lot of reasons. God designed us to breathe through our noses. That's just kind of how we're made. We only breathe through our mouth as a backup, is how it's supposed to work. So we want our noses to be able to filter the air that we breathe in. It's one of our detoxing capabilities. Just like the skin is a filter for what we absorb into our bodies, our nose is a filter for the air that we breathe in to our lungs. Also, all of the cells that are responsible for producing nitric oxide, which is really important for heart health, those are all in our nose too. And we really need to be nasal breathing in order to take advantage of that nitric oxide production.
I'm so glad you brought that up. I don't think people realize what an important role nitric oxide plays in our overall health and how it can reduce cardiovascular disease. But since you did mention the night lays and we're talking about airway issues, I'm curious to learn if you can screen for airway issues.
Absolutely. Absolutely. So everyone that comes into my office, we are asking screening questions that kind of give us an idea on how sleep is going. And then really one of the key points of our new patient exam is we're taking what's called a cone beam CT or a CBCT, and we are physically measuring the size of a patient's airway so we can see how restricted or not restricted it is. There are also signs that we pick up on that physicians just maybe aren't accustomed to looking at. But if I see somebody with flattened off molars and inflamed gum tissue and scalloped borders on the tongue, then I am automatically going to ask more questions about how they're sleeping and history of sleep apnea, history of snoring, things like that, because those are often really telltale signs that there's something going on.
In our first version of part 1 of this 2-part series, we talked about the differences between commercial dentistry and biological dentistry. And one of the most important ones for me when I choose a dentist is looking to see if they offer the 3D cone beam scan rather than x-rays. Can you tell me the difference between this 3D cone beam scan, what it looks like, how it operates, and the difference between x-rays?
Yeah, absolutely. So the CBCT, the cone beam CT, it is still a type of X-ray. It does still emit radiation, but obviously, just like normal 2D X-rays, it's all digital, and so the newer machines emit less and less radiation and give us better and better images. So much more bang for our buck every iteration that those manufacturers have, which is great. And the cone beam CT it's basically, it takes what you would traditionally think of like a medical CT, where we can look at things in 3 dimension. But like the name says, it is more of a cone shaped beam of radiation instead of being a very broad beam. It's cone shaped, very, very detailed. We can focus, basically, I'm looking from just below the chin, kind of middle of the airway, to the eye sockets, with really a fraction of the radiation that a medical CT would have. It's really about the same amount of radiation as what is called a Panorex or a Pano X-ray, the ones that the orthodontists take or the oral surgeon takes to look at wisdom teeth. So same amount of radiation, which is very, very small, and hundreds of times more information than the 2D X-rays have. So not only are we looking at airway size, airway volume, we're looking at any lumps, bumps, dark spots, white spots that shouldn't be there. So it's good at detecting pathology, even better than a pano that we typically take. It's great at seeing wisdom teeth, not just the location in 2 dimensions, but now when we can see the location of the wisdom teeth in 3 dimensions, we can look at how close those wisdom teeth are to the very large mandibular nerve that runs along your bottom jaw. And so we can determine the risk level of nerve damage before we get into surgery and remove wisdom teeth, which is a huge, huge benefit. When we talk about, a lot of dentists are using CBCT now for airway dentistry. They're using them for implant placement because, again, we can see things in 3D, make sure we're not placing the implant in a spot that's not optimal. But then the more holistic offices are using them to have a much closer look at root canals. So we can see, is there any kind of infection going on that maybe a 2D X-ray wouldn't pick up? Our endodontic specialists are using it to see any fracture lines in teeth that might be hiding. That's another big one. And then, if we get even more into the controversial side of dentistry, then we can look at cavitations. And cavitations are just areas of non-healing bone where wisdom teeth or any other tooth might have been removed in the past. Sometimes the bone just doesn't heal properly, and we can actually see those areas, measure the bone density in those areas as well. So cone beam CT is a great tool. More and more dental offices are getting them, which is nice. And especially biological dental offices, it's become a mainstay.
I'm so glad you brought that up because I didn't even know what a 3D cone beam scan was until I listened to a very progressive health podcast where the host said he was a physician. He said, I would never see a dentist unless they did a 3D cone beam scan.
Oh, wow. Nice. Nice. Yeah. I don't think it's not quite considered standard of care yet, but it's getting very, very close.
Oh, but Dr. Ingram, we don't want the standard of care.
We do not. We hope for much better than the standard of care.
Now, you brought up a topic that I love talking about, which is orthodontics and how it has, I don't know if progressed is the right word, but how it's differed from what we went through in the 80s and 90s. So Can we switch gears a little bit and talk about orthodontics?
Absolutely. I'm not an orthodontist, thankfully. I partner with some fantastic ones that are amazing. But yeah, and as we learn better, we do better. And that was kind of the theme. That's kind of the theme of orthodontics over the last 30 years. So really in the 80s and 90s, if we had a lot of crowding, like my orthodontist told my mom, oh, my mouth is just too small for my teeth. Those type of problems, then when it was significant enough, really the only option that orthodontists had were to pull out some premolars, shove things back and straighten them out that way. So it was a great way to gain space. It still is a great way to gain space. And sometimes families will still choose that route, despite knowledge that there are other options. Sometimes we just run out of time. We run out of growth in the kiddo's development where that becomes the only option. But thankfully, when we work with an orthodontist that is more growth and development knowledgeable and more airway aware, the orthodontist I use is very, very concerned with airway. The first thing he did on my own kids was pop them into the CBCT and measure their airway, which was great. And that's, I had already decided that that's what we were going to do, but that's what helped him decide that, yeah, this child is a good candidate for expansion before we even talk about doing braces. We can take advantage of that really big growth spurts that kids have in that, 8, 9, 10-year-old age range. That's a huge growth spurt. If you can do an expander during that time, then it makes braces much more simple. There's room for all of the teeth. And in some lucky kids, it makes braces not even necessary because they've got the room and the teeth come in straight like they're supposed to. So yeah, definitely orthodontics has changed a lot. I was one of the pull teeth out and shove everything back generation.
Yep. I was told my mouth was just too small.
Just too small. And my mom said, have you met my daughter?
You bring up so many good points, which I think are tied back to airway, which I feel like we could just talk about for an entire hour. But if you don't have a proper airway that doesn't let air in, you don't get the nitric oxide, how does this affect a child's development?
Well, there are a lot of ways that we can see visibly. And I can remember them even in my oldest child. I was starting to see she had that airway face. You can start to have what's called a retrognathic mandible, where the lower jaw is kind of tucked back and a little bit small for the upper jaw. You can start getting a longer mid face. So it starts to be some aesthetic concerns over time. A longer mid face, deeper hollows under the eyes, a little more what's called venous pooling, which is just dark circles under the eyes. But it starts to get this very characteristic look where even now my kids can point out. They just did this a couple of weeks ago. They were watching a movie. They were like, oh yeah, we were watching this movie and they were telling me what it was all about. And this one kid looks like he definitely has airway issues. And so yes, I'm doing something right. Indoctrinating my kids well. And really this actor was cute kid with a very long mid face and a very small lower jaw.
It's just that's so sad because I think people think if they can't breathe through their nose, well, then their mouth is just fine. But if they spent the time to read James Nestor's book and dive a little bit deeper into it, I think they would find it paramount.
Oh, yeah, it's really not the same. And that's just, I mean, goodness, that's really just the aesthetic piece of it. but really and truly, like, difficult breathing breeds more difficult breathing in kiddos, especially because if you start breathing through the mouth more often, you're gonna have more inflammation. You're gonna have to filter more air through the back of your throat and your tonsils. That can lead to some tonsil hypertrophy, those enlarged tonsils. In some kids, they get so big that we call them kissing tonsils, where they're just almost touching. Um, that, I mean, good grief, if you've got tonsils that are almost touching, how easily do you think you can get air back there when you're breathing? It just becomes even more difficult and is this really difficult cycle. And then there are all the issues that are a result of poor sleep or less sleep than needed. Bedwetting past the appropriate age of bedwetting. If you've got an 8-year-old that's still bedwetting, then the first thing your pediatrician should be looking at is sleep apnea and airway issues in your child. ADD, ADHD, that's a really common result. Anger issues, especially in young boys, but young girls too. ADHD, anger, inability to concentrate, getting distracted easily, poor performance in school. Those are all things that could be the result of just not being able to breathe properly through their nose.
Who knew, right? Because we're trying to probably pinpoint it on so many other things. Oh, maybe they're bedwetting because they're stressed, they're being bullied at school, whatever it might be. But so many times I feel like if you don't have the right professionals in your life, like yourself, thank goodness you're doing this work and sharing your knowledge. What other kind of solutions are people implementing if they're not looking at the air?
I mean, I know there are a lot of kiddos who are taking basically amphetamines who shouldn't have to be taking amphetamines.
Oh, that's heartbreaking.
Even just that alone, like the allergy medications, the ADD medications, all of this steady diet of pharmaceuticals that we're raising our children on is in large part unnecessary and is in large part overkill.
I couldn't agree more. You and I are on the same page. So are my listeners. Hopefully there's some topics in here that people will want to share with their family members, people who have kids. Since we're on the topic of kids, I mean, I'll put my hand up too and say, I mean, I like sugar every now and then.
Same.
But I'm not sure if it was James Nestor's book or if I read this somewhere else, but I want to know about the pressure that your mouth causes with every bite. And if you're eating something sugary, how that can cause your teeth to actually move. Do you have thoughts on this?
Well, I think it still goes back to those Weston A. Price principles. I think that most sugary foods, most processed foods they're going to require less muscle to ingest. You're really not giving the digestive enzymes, those salivary digestive enzymes, a chance to work appropriately. It just starts this cascade effect of then, you're eating sugar and you're going to have some leaky gut issues because the sugar is causing inflammation in the gut. And then the inflammation of the gut is going to lead to decreased absorption, and the decreased absorption is going to cause inflammation, and that's going to cause some laxity in the ligaments that connect the teeth to the bone. And then the laxity in the ligaments that connect the teeth to the bone are going to allow the teeth to move a bit more.
That's a really good explanation, because I feel like a lot of people are unsure of why their kids need to see the orthodontist. And I'll say one of the examples that I always like to use is my husband has perfect teeth, absolutely perfect teeth, enough room in his mouth for all his teeth. And I know, just like a regular kid, he ate sugar growing up, but his parents were pretty strict, didn't let him eat sugar all the time. And I feel like that ties into he was able to end up with a perfect set of teeth because he was eating the right kind of nutrients.
That's so unfair, isn't it? So unfair.
Wasn't it a dentist way back when who originally created or invented, what is it? What's that stuff called? Cotton candy. Wasn't
I
it a
believe
dentist who
so.
invented-
Yes,
Yeah.
I do remember reading that. Yes.
So, I mean, they can be a bit sneaky if they're commercial dentists, right? If they're the ones behind the candy, then they know.
Yeah, we would always joke about that, especially at Halloween. You know, people would say, "Oh, you need to give me some candy as a good business investment."
So last time we did dive in on fluoride, which is one of my favorite topics, and I will just keep reverting people to your podcast all about it because you take such a good deep dive with really great explanations. But one of the things that you mentioned, which could be more effective than fluoride, is xylitol. And I think last time we just said it as xylitol is a good ingredient, but from what I know, it's a sweetener. So can you give us a little bit of background and science on xylitol?
Yeah, xylitol is a really useful tool for us, especially when we're not using fluoride, but we are trying to decrease the rate of cavities. Xylitol, yes, it is a sweetener. It is made from plants. So it is a plant-based sweetener. It has no to minimal effect on blood sugar, so that's nice. But I don't necessarily recommend that you ingest it, or that, it's not really my favorite to cook with. And I think there are some gastric issues that can come along with it, that it's not a recommendation that I have to ingest it. But as an oral product, as an oral and nasal product, it can be really, really helpful at managing and kind of tilling the garden of our microbiome. So the way that it works in the mouth is that it is similar enough in structure to sugar that the bacteria that cause cavities will ingest it, but they can't metabolize it. So because those strep mutans bacteria, because they can't metabolize what they've been eating, if they've been eating xylitol, then those bacteria become much more slippery and just slip right off the teeth. So that's the primary way. That's the first way that we really, really like it, is it changes the microbiome over time. Another really awesome benefit that it has is that within 5 minutes of putting some in your mouth, it can drastically change the pH of your saliva. So in these cases where we're really worried about acid-base balance and about pH balance, then I always tell my patients to have something with xylitol that you like, some kind of gum, mint, candy that you enjoy, and have that after meals, especially if we are struggling with cavities and we've got an acid-base issue. Then we want to make sure we buffer that saliva, that we raise the pH of the saliva more quickly than it is doing on its own normally.
That's really helpful. I'm so glad you helped clarify that. In between parts 1 and part 2, I listened to a podcast with a very controversial orthodontist who said he uses honey as toothpaste. Do you have any thoughts on honey?
What's funny is my husband is friends with a guy who owns a really big honey company, and I'm sure he would be thrilled if there was some kind of dental partnership that we did. I would say I'm not ready to go there yet.
Okay.
I love the controversy. I love a good headline. I'm not quite ready to go there yet. So yeah, honey is a great antimicrobial. It can help support the microbiome really well. But it still has, it's a very usable, digestible, high glycemic food. And as such, my research tells me that the strep mutans bacteria that like to cause acid and cause cavities would love if you had more honey in your diet.
Okay. I just wanted to hear your thoughts on it because I had never heard that before. So I was like, ooh, I'm going to ask Dr. Ingram.
I love that. That caught me off guard. Now I'm going to have to do some research on it.
Part 3 coming soon.
Right.
So I love coffee. I think that's why I became a biohacker. I first started hearing about bulletproof coffee and I had never drank it before. But when I had it blended with butter, I was like, ooh, I can get on this train. So can you tell me some of the worst foods that are going to stain your teeth and that are acidic and potentially causing some gut issues? And then on top of that question, how to treat that?
I mean, really, soda is the worst. Soda's the worst. If I really have to think about it, it's poison for just about every body part. Yeah, that's really the big one. Now, I'm a coffee addict too. I mean, I have some and it's almost 3 o'clock in the afternoon, that's another story altogether. I have a problem. And sometimes I put butter in it, and a lot of times I put collagen in it. So I do doctor it up with things that are a little more helpful and a little easier on my gut too. But
before you go on, I just wanted for like a nice public service announcement.
Yes.
You should never put your collagen in your coffee if it's hot because it will render it useless.
What?
So
Tell me more.
So sorry, but if you're putting collagen or what's the other one? If you're putting collagen or colostrum in your hot coffee, you might as well dump it down
I had no idea. No idea. Is there a way to put collagen in your coffee and not have it be useless?
I would say if it was lukewarm, if it was borderline, if it had been out for about an hour where you're maybe thinking of adding ice cubes to it.
Right? Interesting. Oh, that's so good. You kind of just blew my brain. I love that. Okay.
So now back to what are a few things that are acidic, really bad for the body, and how do you go about treating the teeth, the gut? I'm just gonna let you take that any direction you want.
Okay, so we talked about soda. Things that are pretty much as bad as soda would be sports drinks, like your Gatorade, Powerade, those types of drinks. And lemonade are kind of all basically in the same category. Sweet tea is pretty close. So all of those are acidic, tons of sugar, usually in the form of high fructose corn syrup, will etch the teeth and provide the cavity causing bacteria fuel to etch the teeth and do damage even further. So that's one thing where even if you are doing everything else right and you have perfect hygiene, if you have a soda habit, then there's not much I can do for you. So stop it, basically.
So stop it. I don't know if you've tried this. I occasionally, a few times a year, I love Coca-Cola in a glass bottle. But what I have found is, I don't know the brand. I'll see if I can find them, put them in the show notes. Is they're these little, I'm pretty sure they're xylitol drops, and they have different flavors, orange, vanilla. They have a Coca-Cola one. I think it just says Coke on the label. And then I mix it with sparkling water. And I feel like that's my fix if people need a bit of a recipe or a substitute for their soda habit.
I think that's a great hack. I think that's great. I don't mind, and maybe I was too harsh before. So when I say there's nothing I can do to help you, I'm really talking about those people who are drinking soda at least once a day, if not multiple times a day for an extended period of time. These are the ones where it's an uphill battle all the time. But kids are kids and humans are humans. We're going to have treats every once in a while. And so, yeah, you can either hack it to where your treat's a little bit better, like a step better than a commercial soda with high fructose corn syrup is maybe a more natural soda that uses at least real sugar instead of corn syrup. A step better than that would be something that you like the hack that you mentioned where it's carbonated water and a sugar-free sweetener. I think those are fine. And those are fine to do as treats every once in a while too. And then I always tell my kiddos, especially in the practice, that I expect you to have treats, but treat it as a treat, not an everyday habit. And then when you do have a treat, rinse with water right afterwards and have a piece of xylitol gum or xylitol mint afterwards too, if you can.
Ooh, I love that. I'm going to start doing that because you said the xylitol will help make sure that you don't make sure that you're less susceptible to cavities.
Correct.
I love that. It's actually, I was waiting for you to bring something up so I could share this story. My husband and I were out for a walk yesterday and I heard this mom tell her daughter, you need to be nice to the kids at school because then at the end of the day, you'll get a cookie. And to me, nice. I just felt like it broke my heart a little bit to hear that we're training our kids like animals, like do something and you'll get a treat. Whereas maybe they could, hopefully they're rinsing with water, having some xylitol gum. I doubt it. But how about, treat the kids nice at school because that's the way the world works. Let's try to do something. Let's try to do something to make ourselves a better society.
Yeah, you would think so. And I love teachers. I love them so much. I have made the personal parenting choice to delegate my children's education to teachers, which is a big deal for me to delegate that because that's something that I feel very strongly is my responsibility. And so I've decided that I'm going to choose a school that can teach them better than I feel like I'm capable of doing. But good grief, teachers, if y'all could stop rewarding my kids with candy, that would be super amazing. And maybe not even just my kids, because my kids I know are going to get good, healthy foods at home. And I know we're taking care of things, but maybe just everybody else's kids. If you could stop giving them candy, that would make my job so much easier if we could reward them with like stickers and hugs and high fives and things like that.
Definitely. I remember we had a reward system when I was growing up for the chores that we did. And yeah, we had soda that was on there, but it was treated like a treat. But the majority of what we wanted to save up our points or rewards for was to have a sleepover or a pizza party. So, we could have those treats. Yeah. But let's put it in a bigger pile and save them up and cash them in for something that's, going to help us drive our cooler.
Yeah. No, I love that. No, I will have to do a whole other podcast on children and habits and rewarding behaviors.
All right. Well, since we took a bit of a diverted conversation,
I love it. I'm down.
I wanted to know, I just have no idea. And I've been doing so much research. I've listened to so many biohacking podcasts. I want to know if charcoal in the form of toothpaste is safe for your mouth.
Yes, charcoal is safe for your mouth. It is very safe, in fact. And most of the time, the abrasiveness is really not even as bad as some of the other powders that can be used. So every once in a while, people will get into a little bit of trouble mouth-wise when they're only using tooth powders to brush with. I love it. I mean, tooth powders are great. That's one good way to make sure that your ingredients are really, really clean, is to have a powder, especially if you're putting it together yourself. But sometimes if they're using just baking soda, that can be a little too abrasive and can irritate the gum tissue. And I see much less of that gum irritation if patients are using charcoal instead. So yeah, it's a really good natural tooth whitener. I'm all for it. I'm on team charcoal.
Oh, okay. The research was so conflicting. So I'm glad Dr. Tony Ingram is here to set the record straight that you can use charcoal toothpaste.
You have my blessing.
Yes. I also listened to a few different shows discussing how soft or firm your bristles should be when you brush. I know there's a few different ways we can take this. So can we get into the firmness of bristles and your preferred method of, or maybe I should say your preferred, I don't even know what I'm trying to say. If you prefer electric or manual toothbrushing.
Oh, excellent question. Yeah, and I have not heard any differing advice or differing conclusions in the peer-reviewed literature on this in quite some time, which is good news, because that means that still, like I was taught in school, still soft bristles are the way to go. Medium and hard bristles are good for scrubbing tile and grout only. And electric toothbrushes do perform better than manual toothbrushes. And I will usually tell patients that in general, you get what you pay for with a toothbrush. In general. Now that just means that a $10 spin brush is going to do a better job than a manual toothbrush. And that means that $100 Sonicare or Oral-B is going to do better than a spin brush or a manual toothbrush. Once we get above the 100, 120 price point, then I don't really see that much difference in actual performance. Then it's more just bells and whistles, and then cuteness of the toothbrush. And I'm all for cute toothbrushes. I like a sexy toothbrush.
My little sister says the exact same. We were in the market for some new toothbrushes, and I was doing a ton of research, and I reached out to her and I said, what is your preferred toothbrush? And she said the exact same thing. If it's over $100, you're wasting your money.
Yeah, well, and except for the aesthetics, aesthetics are important. And now I don't want, like, I'm not going to diss any brand, but there's one or two brands that are available in Target that have really, really cool packaging, and they're really sleek, and I love their packaging. I love the aesthetics of their toothbrush, and they are just under the price of a Sonicare, but still kind of a higher price point. And man, functionality wise, those things suck. So I still, and I'll keep looking. I'll buy a few more here and there because I need to keep up and make sure that all of our listeners can know. But so far, much to my chagrin, that Philips Sonicare is still the best performing in my book and what I see in my patients.
Okay, good. I've been using a Sonicare for years, so that makes me happy.
Same. And every hygienist I've ever worked with has always used Sonicare. Oral-B is a close second, and I do have a few colleagues who prefer Oral-B to Sonicare, but I still, as far as how patients look when they come back in 6 months, the Sonicare is my favorite.
Are there any tips to extend the life of those bristles?
That's an excellent question. If there is, I don't know it. And I'm always struggling to tell patients to buy new heads more often. So, I mean, the main thing is don't scrub like crazy, especially with the Sonicare. You shouldn't be scrubbing at all. Let the Sonicare do the work that it's supposed to do. You don't even have to move it in little circles like you do with a manual toothbrush. You literally just hold it in a spot for a couple of seconds and then move on to the next spot. So don't scrub. That will extend it. You know, if you ever looked at the toothbrush of a 3-year-old and it looks like a shaggy troll doll after a couple of weeks, if your toothbrush looks like that, it's time to change it. Time to change out the head. And then really the only other thing that I would say is make sure that you're letting the toothbrush bristles dry in between uses. That's really and I'm not just a huge germaphobe, but you want your toothbrush to be not disgusting. And if you're sick, then you want to switch out the head. And if you want to not have a gross toothbrush with tons of bacteria, then the key to that is letting it dry in between each use.
Something that my mom would make us do growing up is we were never allowed to store our toothbrushes in the drawer, because I don't know where she heard it or if it's just that motherly wisdom, but to let them stand on the counter so they can breathe, and to never put them near each other, because the germs, I don't know if this is the right story or an old wives' tale, that germs could jump if you store your toothbrushes next to each other.
I think your mom was onto something. I definitely agree with putting them on the counter instead of in the drawer for that reason, because we want them to dry. And yeah, I think if they're in close proximity, there's always the chance that they'll touch and you'll have some bacteria pass back and forth. But then that just goes back to the concept of the transmissibility of your microbiome for good or bad. And dental caries, the disease, the infection that causes cavities, is a transmissible disease. It's a transmissible infection. So anybody that you're sharing a toothbrush with, sharing drinks with, kissing, you're going to share bacteria with them. And that's what that goes back to our first podcast and just cavities in general. We just want to make sure that we are keeping our microbiome healthy and treating the microbiome as a family.
So way back when, I used to think that a toothbrush was like a hairbrush, and I wasn't too caught up on dental hygiene. And I had a boyfriend at the time whose toothbrush I would occasionally borrow. And that was the first time in my life that I got a cavity. So I'm really glad.
It was his fault.
It was his fault.
It was totally his fault.
And so I want to touch back on how you said to brush, because I do have a Sonicare, and I actually will go up and down a little bit on each tooth right near the gum line. But you're saying I can just hold it on the tooth for a second.
Yeah. Yeah. That is what the powers that be at Sonicare teach us, is that, and they even show us little pictures with the fluid flow, the liquid flow in between the teeth and around and under the gum line if you just hold it in place for a couple of seconds.
Good to know.
Yeah.
One other thing that I'll do, again, a tip from my mom, is I'll take my toothbrush head out at least once a month and I'll just put it in the sun. Just let the sun hit it to disinfect it.
I like that. Your mom's a cool gal.
Well, she did have a question for today. She was in a bit of a bicycle accident, and she had cracked a tooth where she already had a gold crown on it. And the dentist, and she had a root canal in that same tooth. And the dentist said he wanted to see what would happen, come back in a month. And she's a bit concerned if she needs another root canal, if the tooth needs to be pulled, and if it is pulled, does she need an implant? I know it's a bit of a loaded question, but isn't that crown supposed to protect from any future cracks?
That is typically the purpose of a crown, is to help maintain the structure of the tooth. Now, obviously, that would depend on how bad the accident was and where the fracture was. It would be, I agree, it would take a pretty good blow to crack a tooth that already had a crown, especially a gold crown, because then there's no concern with porcelain cracking or fracturing anywhere. But yes, it is still possible. And anytime a tooth has a root canal, it tends to be more brittle. And so cracks do happen more often in teeth with root canals because there's no blood supply. When there's no blood supply, it just becomes more brittle. But yes, that answers the first part. Okay, second part was, should she have it removed and should she get an implant, right? I would say if it's cracked and not savable, again, that depends on, does she want to have that tooth in her head? Does she want to have a root canal in her head? Or does it more align with her values to not? So it would just depend on the case and what her goals were. But I would say, yeah, if she decided, or if the dentist decided that it wasn't savable and she needed to have that tooth taken out, then yeah, implants are most of the time a good option. Not always, but most of the time implants are a really good option. And then there are more material concerns after that too. Does she want a titanium implant? Does she want a zirconia implant? What other metals does she have in her mouth? All that good stuff. So hopefully it was just a teeny tiny little crack and it's like a no big deal and nothing, like a chip off the tooth, and then she won't even have to worry about it. But if it's something major, then yeah, I'm hoping that she has good, candid conversations with her dentist and or endodontist, whoever her team is, to go over different options.
I think she just needs you as her dentist.
We'll have her fly on out. I'd love to see her.
Oh, I love that. You make such good points. One of the things that I wanted to bring up, it just popped into my head, but can you walk me through what kind of treatments are available and what you would recommend if someone is experiencing tooth sensitivity?
Tooth sensitivity, usually the first thing that we'll do is start them on a remineralizing toothpaste and see if we can get it under control from there. That's the easiest, quickest way to do it. And MI paste tends to be the best at that, the best at reducing sensitivity, but not always. And the ingredients there are toothpaste with cleaner ingredients than MI paste. But really that's kind of our first step, is a remineralizing toothpaste, something with hydroxyapatite that can help. If that doesn't seem to be helpful, or if it's some more intense sensitivity, then we can move on to something like ozone, where I've got like a little suction cup device that's hooked up to my ozone machine, and we can ozonate tooth by tooth. And so we'll apply some ozone gas to that tooth for maybe 20-30 seconds, up to a minute, and see if that can help with the sensitivity. Again, that just kills some of the bacteria that's within the tubules, helps decrease inflammation, and then ideally helps reverse some of that fluid flow within what's called the dentinal tubules. So that's kind of the theory behind hypersensitivity in teeth. Is, your teeth are basically sponges, and we have all of these little tubules in the hard tooth structure that makes up our teeth. And so the theory is that, and there's fluid that's always flowing. back and forth in these tubules. So the theory goes is that when that fluid flow reverses, then the nerve of the tooth becomes more exposed to the outer elements and becomes inflamed, and then therefore sensitive if something cold hits it or something sweet hits it. So that's kind of the basis behind it. If those things won't work, if the topical things, the things that are kind of in my world don't work, then we really need to dig into systemic inflammation, because I do find a lot of times that systemic inflammation can show up as tooth sensitivity. I'll see it a lot of times in women of childbearing age. Their tooth sensitivity will increase right around ovulation, right before their period, when we tend to feel more things. And so same thing if we've got somebody who all of a sudden their blood pressure or their blood sugar is all of a sudden out of control, just these other hints that there's some inflammation going on. Inflammation shows up in different ways for every person. Sometimes it's as headaches, sometimes it's gut issues, and for some people it's gum and tooth issues. So it's just kind of digging in and figuring out what those triggers are for each person.
Now, what about tooth grinding? What are some of the causes and symptoms?
That kind of takes us full circle, because that brings us back to airway. One of the, how we talked about flattened off molars, flattened off teeth as one of the indications of airway issues. That's absolutely true. So we will often see increased grinding and clenching if somebody has some kind of airway issue, some kind of sleep disturbance or sleep apnea. So that's probably one of the biggest ones. I think the old school theory was that it was all stress. I do think that stress can play a role in grinding and clenching, but it's certainly not the primary cause like we used to think. And then I have a lot of naturopaths, especially in the world of pediatrics, who will say that parasites is a huge cause of some tooth grinding in kiddos. So all things that should be looked at. I tend to look at airway first. And then if airway is not making sense, or if we've already addressed that, then we move to some of these other issues.
That's really helpful. So then I would imagine if you're working with a naturopath with your patients, that maybe you would also do stool testing for those parasites.
Yes. Yeah. The pediatricians that I work with, absolutely. They do a lot of stool testing and nutrient testing.
Okay. I also wanted to learn if you do or offer cosmetic dentistry as well as whitening.
I do. I found that I don't tend to attract a lot of it, just because the values that I practice with. I think cosmetic dentistry is really nice, but I honestly think a real smile is more attractive than a fake smile. I think a healthy smile is better than one that just looks good. And so I don't tend to manifest a whole lot of cosmetic cases. I enjoy them. But I also know I wouldn't enjoy doing them all the time. So I am happy to do some veneers for patients. I'm happy to do whitening for patients, but it's not a mainstay of my practice. And I do attract patients who are very, very detail oriented and very, very educated and self-educate around all of their health and wellness issues, including dentistry. And so with that means they're a little more aesthetically demanding. And so if I know that they want some cosmetic dentistry, and it's going to be one of those where they really want to nitpick all of the details, like they want their lateral incisor exactly 1.2 millimeters shorter than their central incisor, and they want their central incisors the exact same length as their canines. if we know that that's their jam and I'm fine with that, then I am happy to pair them up with a cosmetic dentist or a prosthodontist, somebody that is accustomed to being able to meet those demands very predictably.
I've heard one of the hardest things you can do in dentistry is to match the veneer to the tooth color of the patient. And when I lived in Australia, I had a great biological dentist. I loved her so much. And my tooth number 9 was almost all the way knocked out when I was little. It's a little bit shorter than the other big tooth next to it. And for years, I had been considering just one veneer. And this dentist almost talked me into it. But I said, let me think about it. I want to talk to my little sister, who's a dental hygienist. And I love my little sister so much. And she was like, that's the hardest thing to do in dentistry. And she said, if you want a veneer, don't just do your one big tooth, do both of your big front teeth. And then she said, that can look a little funny. So you might as well do your 4 front teeth.
Yep.
So can you walk me through what veneers look like and why color matching is so tough and or so important?
Yes, especially when it's a single front tooth. If you don't have symmetry in the shading of that single front tooth, then it will look prominent, at least in pictures. It'll look prominent to you, which is what's really important. So yeah, that is tough to match. Usually if we're having somebody do, honestly, if we're doing anything on those front 4 teeth at all, then I lean towards sending them to the lab directly to do a custom shade. That way we're not just looking at the shade guide where we only have 15 options to choose from. We're making it much more custom, and then a good lab technician that is accustomed to doing custom shades can really do a nice job of getting that to match really well. So yes, it is difficult, but yes, it is doable. And yes, your sister's advice is very, very common advice too.
Oh, good. I also wanted to ask, so we talked about the 3D cone beam scan. You told me about the night laze or the night laser. Which one?
Night laze.
Night laze. Can you walk me through some of the other cutting edge technology that you have within your dental practice?
Well, I would say those are really the big ones, is ozone, laser procedures, and CBCT. We have a scanner where we don't have to take impressions anymore, or at least not very often. But that's almost getting to where it's not cutting edge anymore. It's getting more and more common, which is nice too. With that laser, that really is our most cutting edge, because we can do things like night laze. We can do a cosmetic procedure called smooth laze, where we're using that same technique to build collagen fibers on the inside of the mouth that help the appearance of the face. So same type of thing, but it helps smooth out fine lines and wrinkles, which is really cool. We can use that same laser for just about anything, for cutting soft tissue, for doing tongue tie revisions, for doing frenectomies, the little tongue tie revisions on infants even. We use it on hard tissue, so we can use it to remove some decay, which is really nice. And then all kinds of little fun gum procedures, and just areas where we need to decrease inflammation and do this photobiomodulation, where we're decreasing, I'll get it out eventually, where we're decreasing inflammation with the laser energy.
Ooh, I love that. When I saw my dentist in Australia, she wanted to redo a cavity, refill a cavity. And one of the first things that I did when I came home from that procedure was, I have this little Vi light. It looks like a small Christmas light. And I just held it in my mouth for about 20 minutes, hoping it would just help the area heal from having a bit of work done. So I like that you use photobiomodulation.
Yeah, that's good stuff.
Do you offer a vitamin C drip?
We do, yeah. And we'll do that after big procedures. If somebody's having their wisdom teeth removed, or if they're having their amalgam fillings removed, then a lot of times we'll have our IV nurse come out and do an IV with some high dose vitamin C, some glutathione, some other fun goodies that he puts in to make the yeah.
Love the sound of that.
Absolutely. It makes you feel nicer the day afterwards too, because he puts in a nice good B complex. Helps decrease inflammation and detox from the meds a little bit faster, especially if you're sedated for the procedure. Then it's nice to have that detox capability enhanced.
So these are some of the most important questions that I look for when I am looking for a new dentist, is if they offer ozone, which is cutting edge, if they have a vitamin C drip, if they have a 3D cone beam. Those are usually my top 3 pillars for looking for a dentist, because you're not going to find a commercial dentist. I imagine it's going to be very rare if they would offer that. You're going to be led down that path to find a holistic biological dentist like yourself. So one of the stories that I wanted to share today was my bad dental experience, which has been the only one in my life. But part of the reason I started this show was because I want listeners to advocate for themselves and to not get caught up in marketing, which I definitely did. This company used the word holistic everywhere. They had 5-star reviews. They had maybe too many 5-star reviews, which you feel like they maybe are giving you some kind of monetary or financial reward to leave that 5-star review.
Mm-hmm.
And when I went to see the dentist, I thought it was very peculiar, but they didn't have dental hygienists. When I went to get my teeth cleaned and the dentist cleaned my teeth, and I would like to think, very good oral hygiene, there was blood everywhere. Those little gauze pads, the way that she was cleaning my teeth, blood everywhere. And my little sister, when she would clean my teeth, she would always prep me and say, if there's any pain, if anything doesn't feel good, raise your hand. And, you know, I'm sure you've seen it when something doesn't feel good, the patient will twitch. You can just tell that they're sensitive to that.
Yeah.
This dentist kept working and kept working. And then she said, we're going to do x-rays today. And I had already emailed the front desk reception what my 3D cone beam looked like about 6 months ago. And I said, I don't think I need x-rays. I just had them 6 months ago. Usually I get them every year. And I felt that pressure from the white coat to say, you have to have them done. And it was just such a bad experience. And so I just want listeners to know the important questions to ask and what to look for when it comes to a biological dentist. What else would you add, Dr. Ingram, is important to make sure that patients find someone who's going to care for them in a way that's not just get them in, get them out?
Oh, well, I hate that you had that experience. I'm so sorry. We need to find a way to get your sister to where she can clean your teeth all the time.
Right?
I feel like that is her obligation as your sister. Wherever she's at, she needs to fly in or fly you out.
That's right.
To do your cleaning. Man, I would say you've got to get a good feel from the get-go. If you don't have a good feel, if you don't feel comfortable, then you've got to advocate for yourself and be willing to say thanks, but no thanks. And you know that the x-ray question is one that I get a lot, and obviously who we see, we get a lot of pushback on x-rays, which is completely fine. And it's always the patient's choice. But because everything else about the experience for you led you not to trust that dentist and trust that practitioner, it made that just one more conversation, one more nail in the coffin of you feeling like this person does not have my best interest at heart. which is really crummy. So I would say, even amongst holistic dentists, even amongst biological dentists, there are people whose bedside manner is really good and really helpful and really conducive to good relationships and good two-way communication. And then there are some who that's just not their jam, and maybe not what they're great at. So it's not necessarily just that. The same as you can find a more traditional, a more mainstream dentist who does have great communication, who is willing to sit knee to knee and eye to eye and be able to explain why they need x-rays and why they don't, and be able to still get you to a point where you feel good about the relationship and you're getting the care that you need while they're protecting their license as they're practicing. So man, that's a hard one, because I really was expecting you to ask me how to find a holistic dentist, and I was going to point you to the best directories to find holistic dentists. But even when you do that, it's still a matter of that one-on-one relationship, that getting a good feel, being an advocate for yourself and for your kids when you're taking your kids to the dentist too, and just feeling good about it, which I know is like a pansy answer, but that really is the best answer that I have.
It's a very genuine answer. I appreciate that. Now, I do want to ask, what are these directories? How can people find more dentists like you?
Yeah, so that one's easy. That one I can do. So the two biggest organizations that provide training and meetings in biological dentistry, they both have very long names. So one of them is the IAOMT, M as in Mary, and that stands for the International Academy of Oral Medicine and Toxicology. And the other one is the IABDM, the International Academy of Biological Dentistry and Medicine, or Medicine and Dentistry. I always forget and get those switched. Both of them provide training in biological dentistry. Both of them have very active directories. And you can even see, I know I'm more active in the IAOMT. That's where I got my accreditation. And so I know for sure on that directory, they'll even have how many meetings the dentist has been to. So you can kind of get a feel for, okay, are they really into this, or are they just checking off the box and becoming a member? It has their accreditation status and if they are SMART certified or not. And SMART is just the techniques for safely removing amalgam fillings. So I would say definitely look for somebody who at the very least has gone through that process of committing to safely removing amalgam fillings. In the IAOMT, it's called SMART. And in the IABDM, I believe it's called the PROTECT protocols.
That's really good information. I appreciate you sharing that. I also wanted to touch on the books that are important when it comes to educating yourself. In your podcast, you mentioned the fluoride deception. I think last time we talked about one of my favorite books, The Hidden Epidemic. What other books would you recommend listeners get their hands on so they can educate themselves?
Oh, let's see what's on my shelf right now. I have Breathe back behind me. Let's see here. Let's go to my bookshelf. Let's see what we have.
And so she's mentioning Breathe by James Nestor. That's one of my top favorite books. I think we've mentioned James at least 10 times on this podcast today.
Yeah. Oh man, we're going to be so excited.
She's bringing them all.
I'm bringing them all. Okay. And I'm running out of room. In my arms. So still on the shelf is The Dental Diet by Dr. Stephen Lin. That's a good book. if you want like the long version of Dr. Lynn's book, it's just the Weston A. Price book. Shh, don't tell anybody I said that. But Nutrition and Physical Degeneration is kind of the classic. That's all the growth and development stuff.
Which maybe we want to put a disclaimer in there that there can be some really confronting pictures.
Yes, for sure. For sure. Breathe by James Nestor. This one is a cute little quick read called The Natural Cure for Tooth Decay. It has some good tips and tricks in there. Nardine Artemis's Holistic Dental Care. Again,
I love her. Oh, she's on my wish list to come on my podcast to talk about her toothpaste, all her natural beauty products. They are my go-to.
Nice. And these, I really love these, with lots of caveats, but still a net good for all of us who like to biohack and like to educate ourselves. Ramiel, is it Nagel's books, Cure Tooth Decay was kind of his classic, and Cure Gum Disease Naturally. Lots of good tips in there. Also on my shelf, Your Toxic Teeth. That's a good one. All about mercury. Bio Young. This one is really cool. This is about, it probably has nothing to do with teeth. It's all about like essential oils and skincare and stuff. A great one in oral systemic health. Anybody who has heart disease or has a family history of heart disease, it's called Beat the Heart Attack Gene. The two authors of this book, Bradley Bale and Amy Doneen, they teach a lot of classes, and I really, really like their methods, but man, they are great at what they do. So Beat the Heart Attack Gene is a fabulous book. Another really awesome dentist, again, not so much on the holistic side, but kind of in some ways she is Susan Maples. I just love to listen to her speak. Susan Maples is phenomenal, and I kind of want to be her when I grow up. But her book is called Blabbermouth, and so it's all about oral systemic health. Yeah, if you can get Susan Maples on too, she's fantastic, and she does a lot of speaking and teaching.
Noted.
And then one area that I really have done a lot of reading and digging in on in the last couple of years, especially, is I've noticed much more issues with trauma showing up in my office. It affects how patients are able to take care of their teeth and how patients are able to tolerate the treatment that I recommend that they get. And so one book on that is called The Body Keeps the Score. And so it's another fantastic book. And really, over the last couple of years, it's really been eye-opening how literally trauma affects your fascia, it affects your cells. It is stored in deep places physiologically in our bodies. And so, The Body Keeps the Score is a really, really good book about trauma.
I'm glad you shared that. Thank you. All right, Dr. Ingram, one last question.
Yeah.
What haven't I asked you that you'd like my listeners to know?
Ooh, we've talked about so much. We did not talk much about tongue tie revisions in regards to a fascia release in the body. So I would say just kind of the quick and dirty, the fast and furious is a tongue tie release is really, when it's done well, when it's done properly, the tongue tie release is the completion of a fascial release. So we take really special care to make sure that our patients are getting the appropriate body work, that they're getting that the care of their fascial system to make sure that they're ready mentally, emotionally, to make sure their fascia is ready to have a tongue tie release, so that the tongue tie release, the actual revision, is just the completion of that. So I would say that's the only one thing. So if any of your listeners are either, if they have a little one that's tongue tied, or if they themselves are thinking about getting a tongue tie revision, to make sure that they are also seeking out the appropriate body work from a skilled body worker before they have the procedure done.
So do you have, I probably should have asked in the beginning, do you have a little bit of time to go over?
Yeah.
Okay. Because I can edit this in so that last question, or we can just keep going as the flow goes. It doesn't have to be the last question, but I would love to learn more about the body work that can be done and how they can get this resolved, and then potentially what causes tongue ties.
Ooh, what causes tongue ties is kind of the $1 million question. And there are some theories going around. And I think the current best theories are a lot of stored trauma, stored toxicity, things like that that are passed to our babies. But what I do know is that every midwife that I've talked to who's been a midwife for at least 2 decades, they all are saying that they are seeing more tongue ties now in babies than they did when they first started. And none of them really can say with certainty, is that just because we're more aware of tongue ties? Or is it really that we have that much more stress, trauma, environmental stress in utero, or the exact cause of it? But those are some of the theories, is that it is stored stress, whether that is emotional stress or environmental stress.
And then can you walk me through the body work portion, or how you can find a good body worker to help resolve these issues?
Yeah, so there are some really good cranial sacral therapists, and even some massage therapists, chiropractors. The main thing is that they are trained in doing tongue tie revision body work. And that will look different for each practitioner. The ones that I work with here in Texas are really adamant on, if it's an infant or a child that we're working with, then they insist that mom also gets body work done as well. So we treat the dyad. We treat mom and baby. We never treat just baby. And that really, I find, has been incredibly helpful in how babies do afterwards, in their response afterwards, and in mom's stress afterwards, because it can be a stressful procedure for mom to have to listen in on. And then there's all kinds of exercises that they have to do afterwards. It can be stressful if they're not well prepared. And so the body work, the love and care that the cranial sacral therapist or whomever is giving can be really instrumental in making sure that they're calming everybody's nerves, kind of getting everybody into a place of rest and digest and nurturing in there.
I'm glad that we did touch on this topic, because I don't know if people know that the fascia runs from your head to your toes. It connects, it's literally touching every part of your muscles, connecting it to your skin. It's all connected.
Correct. All connected.
Okay. Now, is there anything else that you want to make sure that we touch on? Because I know we wanted to make butter pulling a thing. We talked a little bit about honey, caught you off guard. I feel like maybe there'll be a part 3 coming up where I'm like, doing some research that comes across my desk. Right. Is there anything else? you wanted to touch on today?
No, but I'm really excited about the future of honey brushing and then butter pulling at the same time with a piece of warm bread, because I feel like that would all go together really, really well. And then we'd have to talk more about the dangers of gluten and insulin resistance after the bread.
Oh yeah. Oh, well, insulin resistance is paired to nitric oxide, which is something that I'm really passionate
Right.
about. I could talk about again for hours and hours.
Yes.
But we'll wrap it up there. It was such a pleasure having you on the show again. Thank you so much for your time today. We'll make sure we put everything in the show notes, the books, all those long letters of where people can find dentists like you, as well as where people can find all your information. But one more time, what's your website?
Our website is www.flourish.dental.
Wonderful. Dr. Ingram, thank you so much for your time today.
You bet, Ashley. Thank you.
All right, folks, I hope you enjoyed today's episode. That wraps it up for us today. We'll see you next time.